Good hips equal a healthy lower back. So whether your goal is to overcome lower back pain, so you're in that rehabilitation phase, or whether you're looking to build core strength and stability, good, proper functioning hips is a fundamental for you. And in this tutorial, we're going to be looking at what are good hips. What are good, proper functioning hips? So we're going to look at the anatomy of the hips. We're going to then sort of build out within the anatomy. So we'll look at the hip sockets. We'll look at the hip joint. We'll look at the muscles of the hip. We're also going to look at some of the muscles of the spine. And within all of that, we're going to be talking about exercise selection that comes off the back of understanding that anatomy. In part one, I'm just going to talk to you generally about some of the forces that can go on the lower back and why we need to get the force generated from the hips. So when we look at the spine, what we've got are vertebrae that sort of sit on top of each other, and in between we've got discs. We've also got ligaments and muscles that then go around the spine. Now, when our hips aren't working properly, so for example, when I go down to lift this kettlebell up and my hips can't flex very well, I'll get down this far and then my hips won't let me go any further. So how I'm going to get down here is I'm going to flex at the spine. Now that's an ineffective way of lifting a kettlebell. It's also going to increase your risk of lower back pain, and it's also going to diminish the way that your core muscles are working. So when we go down into this position, there are a few things that are happening. First of all, if we start with the vertebra. When I go into a flexed posture, like so, like when I'm going down to lift that weight up, if you can imagine, you've got the front of the vertebra, the back of the vertebra, and then you've got another one sat on top and there's a disc in between. When I flex the spine and go to lift that weight, there is what's called an anterior shear force on the vertebra that's causing it or wanting it to be pulled forward over the front of the other one. That obviously is not an advantageous thing for the spine. When we come into a more neutral posture, what happens when the muscles of the extensor muscles of the back, when they activate, they create a counter force, so a posterior shear, which is basically pulling that back into position. So it's, in some respects, it's neutralizing the anterior shear and holding it in place. So if I'm keeping this neutral posture, but I can only get down this far, I can't lift that weight. So what we need to be able to do is encourage that greater hip flexion. So by getting proper hip function, we can get that proper hip flexion, which is going to be advantageous for our vertebra. Next, if we move on to the discs. So again, if I come into this position and I go to lift this weight in this flexed posture, as I've mentioned, it's affecting the vertebra, but it's also affecting the discs. So if you can imagine a vertebral disc, so if you're looking down on the top of a disc here, what you've got is a fibrous wall on the outside and sort of a ball of jelly-like fluid in the middle. So when you go into the flexed posture, you're basically going into, you're sort of creating that arch at the back. So you're pushing the front down and lifting the back up. So that would be the neutral posture. When I flex, it goes like that. And obviously there's a force pushing the front together. So all that's happening to that fluid is it's getting pushed to the back. And that's increasing risk of disc bulge or full disc herniation. So again, that's something that we really want to be understanding. When we come into that neutral posture and we just push straight down, the forces get distributed evenly all the way around it. So if you can imagine a seed in between my thumb and index finger and you push straight down on top of it evenly, it stays in the middle, which is what happens to the fluid. But if I push down on the front, it wants to be pushed towards the back and pop out the back of my thumb and index finger, which again is exactly what's happening when I come into this position here. As a sort of an extra note, the ligaments also get overstressed, and they can become lengthened, and they can become laxed as well. So we've got in these two parts that I've talked about, all of the passive tissues, the bones, the discs and the ligaments, they are all overly stressed when we're talking about properly functioning hips. To finish off here, now that we've talked about the spine going into that flex position as I'm lifting, what we can now start to talk about are the hips, because it's not advantageous for the spine to be in that position. I've started introducing that neutral posture by saying that it neutralises that anterior shear. What it also does is it neutralises the forces on the jelly-like fluid on the inside of the disc. What it also does is it causes the hips to do their job properly. Now the hips are where the force and the power should be generated from. For one very simple reason, that's where the bigger and stronger muscles are. So when we come down, we want to get in right down into the hips. We obviously need, with the hip flexion, we obviously need the external rotation as well to be able to get into that sort of hip hinging position, so we can then lift up the weight. So the movement is essentially the hips going back and the hips going forward, which is getting the glute max, glute minimus, glute medius to work properly. Glute max does the hip extension as we go forward, and then we've got for the external rotation of the hip, which is stabilizing the joint or stabilizing the hip, we've then got glute medius and glute minimus. So just to quickly summarize this part, number one, stresses anterior shear on the vertebra. We've got stresses on the jelly-like fluid in the middle of the discs. The ligaments are becoming lax, and the forces want to be generated from the hip because that's where the biggest and strongest muscles are. In this part, we're going to be looking at a little bit more of the hip joint anatomy and what is that telling us about our function. So there are essentially two different types of hip joint. There is a shallow hip socket and there is a deep hip socket. So if we look at the shallow hip socket first, now the shallow hip socket is the hip for deep squatting. So it's where you can get down into that bottom position. So although I've not had them looked at, I wouldn't say I've got shallow hip sockets, and I'll explain why in a second. But basically, a deep squat is where we go all the way down into here. So we're essentially doing the whole ass to grass type position. Now, if I had shallow hip sockets, I'd be able to get down there with a neutral spine. And as you've seen, I can't do that. Now, that's advantageous for the people that can do deep squatting, because essentially their body is allowing them to do it. If we then move on to the deeper hip socket, what we've then got, these hips, they aren't very good at getting down into the deep squat, but they are very good at changing direction. So when it comes to sports, they will be very good for football, they'll be very good for tennis, they'll be very good for things like American football, they'll be very good at hockey, so on and so forth. So you can start to see now that sports are starting to be selected. Now there's one caveat that comes with that, is that if I am loading the hip, I then don't really want to go down into that deep squat. If I'm loading and lifting a big heavy weight, for the reasons that I talked about in part one, I don't really want to be going down low. If, for example, I just do a bodyweight squat, the forces and the loads on the spine are a lot less. So that can be useful to do, and it won't have as much stress on the body as when it's loaded, because the loaded or a loaded exercise will put more stress on the lower back than a bodyweight one. So that's the kind of the caveat that comes with that. You can deep squat if you've got my type of hips, because I can get down there. But I would only really do that in a bodyweight environment. I wouldn't load that because it's not going to be advantageous to give my to keep my lower back healthy. So again, if we can understand that we can get down into these positions with that neutral posture, then we can get down into the deep squat. Now that doesn't mean people with deep hip sockets that can't get all the way down shouldn't necessarily lift from the floor, because I know that I can get into this position and I can lift that weight from the floor without rounding my spine. So I can get all the way down there with a neutral spine. So I can lift something from the floor. I just wouldn't use a deep squat position to do it, or I wouldn't do a deep squat with a big bar on my back. I would just use a weight, maybe just come down this far and go back up. But again, that will be determined by what my spine can do. So what I'm doing is I'm not just making my body do exercise, I'm understanding the makeup of my body, I'm understanding what is more suitable for my body, and then I'm choosing those exercises. So I'm understanding my anatomy and then selecting the exercises rather than the other way around, by just making my anatomy do certain exercises because they may not be advantageous for it, because we're going to be stressing the lower back. In part 3, we're going to look at the muscles of the hip, and we're going to start understanding what they're telling us as well. So again, that can inform our exercise selection, for example. So first of all, we're going to start off with psoas, iliacus, and hamstring. Psoas and iliacus, or let's start with psoas. So psoas comes off the spine, so it's covers L5, L4, L3, L2, L1, T12. So it basically goes all the way up the lumbar vertebra, goes through the pelvis and joins onto the inside of the femur or the inside of the upper leg. Iliacus starts on the inside of the iliac crest, goes down through the hip, again into the same area or a similar area to the psoas. And then obviously we've got hamstrings on the back of the leg, which they cross the knee all the way up and then in the bottom of the pelvis. Now, for the hip, those muscles are all stabilizers of the hip and of certainly the psoas of the lower back. So when it comes to exercise selection, we don't necessarily need to be doing, let's just say for the psoas and the iliacus, we don't need to be doing repetitions of this type of movement, potentially with a cable where we're sort of lifting up through here, because stabilizing muscles are fundamentally different than, let's just say, power generating muscles. What stabilizing muscles need is good timing. So for example, if I come into this position, what we want are the adductors and glute medius, glute minimus to stabilize the hip joint. So if my knee's moving all over the place, side to side, that's because my glute medius, glute minimus, adductors aren't holding it in the middle, because it will collapse to one side, glute medius, glute minimus will pull it back, and then adductors will pull it back, and the muscles are constantly fighting each other to maintain equilibrium. But once we're steady, then we've got stability. So with regards to psoas, iliacus and the hamstrings, single leg stances are absolutely perfect for it. So we're creating a little bit of tension here, just holding, and then we're up on one leg. So we're not going through big ranges of movement because we don't need to. The muscles, certainly the psoas and the iliacus, don't need to be strong, because just to be able to pick the leg up doesn't require, let's say, like a 20 kilo weight on there to do that. All it needs to be able to do is lift the weight of the leg up, and then as it hits the floor, it needs to stabilize the pelvis. So again, when we're choosing certain exercises, we're choosing them for certain reasons. Obviously, the first one is there to stabilize. And as I've mentioned, the second part of that are the adductors and the glute medius, glute minimus. So again, they're stabilizing exercises or stabilizing muscles that need timing. So we're holding here. So we want a nice steady knee, we want a nice steady spine, and then we could just kind of go into this position. So we are getting good control through the standing leg and good motion through the hip flexors of the moving leg, and then obviously we can change over. We've got that. That's one exercise. There's lots of other exercises you can choose. Multi-directional. Obviously we've got sagittal, and then we've got sort of side lunge, or those sort of skater type exercises that come as well. Finally, we've got glute max, which is the big, powerful generator of force. So this is the one that we want strong. We could include the quads in this as well if we go into the squatting, but if we're just talking about hip hinging, then we want glute max to be as strong as it possibly can, because that's where all the force is generated. Now, we've talked about the stabilizing muscles, so what I'm also going to do is include glute minimus and glute medius in this one, because what it also does, those muscles create the joint torque. So it creates a torsion at the hip, which is essentially stabilizing. This is if we're doing a squat or a lift from the floor. It's stabilizing the knee and it's stabilizing the ankle and the foot. Because when we drive the knees out, we're activating glute medius, glute minimus, or portions of it. What we're also doing is you may also get a little bit of bicep femoris activating because of the external rotation of the hip or of the knee, and that is tensioning all the way down the side of the muscle all the way down the side of the leg. And then what's happening, that's stabilizing the pelvis on both sides. So what we can start to do is we can start to understand what type of muscles are doing certain jobs. If we can understand what muscles are doing certain jobs, we can select exercises for those muscles or for those patterns that we want to be including those muscles within. So if we just take a lift from the floor, which is what we talked about a lot, we come into this position, we hinge at the hip. So we hinge at the hip, we maintain that neutral posture, we drive the knees out, we can get down. So I've got tension all through here, and then it's basically I'm pushing my hips forward and activating the glutes all the way through that. Not necessarily because we want to keep them active all the way through the movement, it's just to keep that stability through the hip. So a lot of, when it comes to bodybuilding or muscle building in the hip area, they talk about it's not necessarily necessary to come forward and really squeeze the glutes because there's no great load on the hips. But we're not doing it for that reason. We're trying to create, first of all, the force to lift the weight, but as we get to the top, to stabilize everything and keep it all in position because we have got a heavy load on our body. So it's a slightly different reason for doing things. So we come down into position, we're maintaining the neutral posture, and then it's basically hips, grab on tight, push the hips forward, stabilize. So we're still screwing the feet in and maintaining that stability all the way through the lower body so that when we go back down, we've still got stability, because what we don't want to do is get to the top of the movement, shut everything off, and then lose that stability and then go to the floor and try to turn it all back on again. So to summarize this video, what we've talked about are good hips equal a healthy back or a healthy lower back, for the very simple reasons that it minimizes the stress on the lower back and it gets the hips working properly. So not only the hip joint, but also the muscles of the hip as well. So we're able to get the stabilizing muscles to stabilize the joint and the power generating muscles to move the joint. So hopefully that's been helpful. Hopefully it's given you an insight into some exercises. There are plenty more out there, but hopefully it's given you a better idea of what you need to do, why you need to do it, and how you need to do it.